How to detect diabetes symptoms. Diabetes is a condition that causes your blood sugar, or blood glucose, levels to be too high. Glucose gets into your cells with a hormone called insulin. There are two types of diabetes, type 1, which means your body doesn't produce insulin, and type 2, which means your body doesn't make or use insulin well. In addition, some women develop gestational diabetes during pregnancy. 1. Recognize your risk for diabetes. The following factors may increase your risk of type 1, type 2, or gestational diabetes. Family history. Environmental factors, such as exposure to viral illness. Presence of autoantibodies in the system, usually after a viral syndrome when the person is young. Dietary factors, such as low vitamin D consumption or exposure to cow's milk or cereals before the age of 4 months. Weight. The more fat cells you have, the more resistant to insulin they become. Sedentary lifestyle or inactivity. Exercises helps control weight and insulin. Race. Certain groups such as Hispanics and African Americans are more prone to diabetes. Age. Your risk increases as you get older. Polycystic ovary syndrome. High blood pressure. Metabolic syndrome. Gestational diabetes and giving birth to a baby over 9 pounds can also increase your risk for type 2 diabetes. 2. Be aware of what doesn't cause diabetes. Diabetes is a condition related to blood sugar, so some people might think it's related to eating sugar. Eating sugar doesn't cause diabetes, but if you are overweight then you can develop peripheral resistance to sugar, therefore, you have to cut down on the amount of refined sugars that you consume. 3. Determine possible symptoms. Many symptoms of diabetes may not seem serious and aren't necessarily specific to the disease, so it's important to watch your bodily functions to detect potential signs. Identifying possible symptoms of diabetes can help you get a timely diagnosis and treatment. Symptoms of diabetes cancer include increased thirst, increased hunger, especially after eating, dry mouth, frequent urination, sometimes more often at night, unexplained weight loss, weakness or feeling tired, blurred vision, numbness or tingling in the hands and feet, cuts and sores that heal slowly, itchy and dry skin, generally in the vaginal or groin region, frequent yeast infections, frequent infections of the skin and gums. 4. Keep track of possible symptoms. Watch every bodily function that may be related to diabetes, including how you feel after you eat, if you're thirsty more often, if you urinate more often, and even how quickly you heal from cuts or sores. Write down the specific symptoms, how often they occur, and what makes them better or worse. Make note of any feelings you experience that aren't necessarily related to diabetes. 5. Ask your significant other if he has noticed symptoms. Tell your spouse what the different symptoms of diabetes are so that he can tell you if he's seen any changes in you or your bodily functions.